For many women, a breast cancer diagnosis often leads here: surgery and chemotherapy or radiation, followed by years of hormone therapy. But new research says some patients may be able to skip radiation.
The findings were very impressive.
Published in the New England Journal of Medicine, the Canadian study followed 500 women over the age of 54. All had low-risk breast cancer. Their tumors were slow-growing and smaller than 2 centimeters, and no cancer was detected in their lymph nodes. After surgery, patients did not undergo radiation, instead going straight to hormone therapy, and were monitored for 5 years with annual mammograms. The results? Only 2.3% of the women in the study had breast cancer return, a low rate of recurrence.
Now that we can identify women who don't require radiation, at least in a significant number, it's going to allow them to avoid the inconvenience and side effects of treatment.
So the diagnosis was a bit shattering.
New grandmother Karen McNabb was diagnosed with stage 1 breast cancer last summer. She underwent surgery, followed by 16 rounds of radiation.
It is quite painful. My right breast was rock hard, and it was blistered and raw.
McNabb says her most recent mammogram was clear, but she still feels the effects of her treatment. And she says if her oncologist recommended opting out of radiation, she would listen. Experts say this research may give low-risk patients new treatment options.
In the next couple of years, I think we'll have some of these tests available where we can sit down with a woman and say, here's your risk of the cancer coming back without radiation. Here's the risk of the cancer coming back with radiation. There's no difference in your particular case.
Researchers say they will continue to monitor the women for an additional 5 years and say they hope their findings help future patients avoid any unnecessary procedures. Tashana Reed, CBC News, Toronto.